right, so Fox 40's Tony Salazar, he's live in Fairfield with how they're bringing all of the necessary tools to raise awareness and also save lives. Tony, good morning.
Hey there, Melanie, Bianca, good morning. This comes on the heels of Diabetes Alert Day, and it's all centered around not only the awareness of diabetes, but also the seriousness and the importance of getting screened now rather than waiting till later on when things can get much worse. We're standing right outside. Right next to me, you can see the Diabetes Mobile Education Center has been making its round around Solano County, and it all starts with a simple survey as well, along with a team of experts who will guide you through this free process. Dr. Jay Schubrook joining us right now. Dr. Schubrook, you have been doing this. I mean, you are the expert when it comes to diabetes, and you're telling me there's so many different forms of diabetes, right? Different types. Type 1 and type 2 diabetes, I would think, are the most common. What can you tell me about that?
Yeah, so I think first off, diabetes is incredibly common. It affects more than half the adult population, and knowing what type is really important because the treatments are very different. Type 2 is by far the most common and the one that we do screening for most commonly before people develop symptoms. But we do the same for type 1 as well. So first of all, know your risk and know your type.
And know your type here. And so we're actually going to walk inside this mobile diabetes education center. And, you know, what should folks know when they come out here and they go through the survey process? What's next up for them, Dr. Schubrook?
So I think first of all, to let people know that we offer free screenings to anyone who wants to come, adult or children. And we screen for both a diabetes risk test, a glucose, A1C, lipid, blood pressure, and we really want people to know what their risk is so they can take action. And we have the ability to do all this for free, but we also have a certified diabetes educator on board who can really help with giving you immediate information that can help you to know what to do next.
And then let's say, you know, somebody goes through their survey process and they go through getting, you know, their finger pricked and go through that process as well, and they end up being, you know, they do have type 1 and or type 2 diabetes. What's the next steps?
So first of all, it's very important to know that the earlier you find it, the more you can do. And we have a network of classes and resources we can give to anybody who gets screened, but we also have the ability to link them to their medical provider or their medical home so they can get immediate treatment. And having that screening and having that paperwork really helps them to give actionable data.
And, you know, doing this early on and instead of waiting till later on, I mean, that's key. I mean, because you're telling me there's millions of folks out there who don't even know they have diabetes, Dr. Schubrook.
Yeah, the great majority of people with prediabetes and many with the type 2 have no idea, and it's hard to act on something you don't know you have. And so I think knowledge is power, and we want people to be able to act before it becomes something that really impairs their life.
And then there's two things I want to ask you: physical activity and the role a well-balanced meal, like something we're seeing here and something we always, right? I mean, we grew up talking about this. You got to have your veggies, got to have your protein, got to have your fruit in there. I mean, why is that so important along with physical activity when it comes to diabetes?
Well, I think no matter what type of diabetes you have, healthy eating and movement are important parts of treatment. And so, if I took anything from this plate, our plate might look very different based upon our background, our family norms, but make sure that plate has half vegetables, has some source of protein, and has some carbohydrate. And if you do that, that's the first and most important step, especially if it's whole foods. And then just taking a 15-minute walk after every meal is a great way to engage activity. You don't need to go to a gym, you don't need to be a runner. Just movement makes that fuel get into your body so you don't store it and become at risk for diabetes.
So starting as simple, not only eating a well-balanced meal, maybe a 10-minute walk, then gradually upgrade it to a 15, 20-minute and so forth. I mean, let's step outside here for a quick second here because I want to show you this full screen. This is it outlines all the different stops as far as where this Diabetes Mobile Education Center is going to be out through Solano County. Today, you guys are out here off of East Alaska Avenue and North Texas Street, right behind this Popeyes. It's hard to miss this trailer. You guys are going to be out here till 2. What's next for you guys, let's say on Thursday?
So we'll be going later this week to Dixon and then to Sassoon. Anyone can look on our calendar and see where we're coming. You might notice that we have things in multiple different languages and multiple different ways to support. So come, we want to screen you, we want to get you information, and we'd love to have you join us.
Well, Dr. Jay Schubrook, thank you again for your time. Very important to know, especially as spring break just kicked off and the heels of, Diabetes Alert Day here. Again, a simple survey, a simple screening is all it takes to know whether or not you are and you do have diabetes. But again, as Dr. Schubert said, early prevention is key. They're going to be out here. That is the Diabetes Mobile Education Center till about 2 p.m. Again, it's off of East Alaska Avenue and North Texas Street. Look out for the big old trailer. They're going to be out here till 2. And again, everyone is welcome. That's the very latest. We're live this morning in Fairfield covering local news that matters. I'm Tony Salazar, Fox 40 News.
Okay, if you have family out there in Solano County, tell them stop by.
And it could be unsuspecting too, so get tested. All right, thanks, Tony.